Hi, everybody. Dr. Demito here. We are going to speak about head and neck in this lecture. Let me get over here so that I can there we go. So, the physical exam components of the head, you want to observe the head position in different positions. Tilted, is there a tremor? So, when they're sitting there, do they tilt their head to one side over the other? They may not even recognize that they do that. You want to inspect the skull and the scalp for size, shape, symmetry, lesions, any trauma that may be present. And inspect facial features for shape, symmetry, characteristic facies, pallor or pigmentation variations, any unusual features or tics that the patient may have. So you really need to hone in on your assessment skills when you are evaluating, well, really any body system, but especially head and neck. When you're palpating, you are feeling with your hands that symmetry. If it's a infant, sutures and fontanelles, you're feeling that hair texture. Is it the color and the distribution? Are there any patches, bald spots? Are there any lesions on the scalp? Scalp movement, tenderness, um, especially over frontal or maxillary sinuses. So this is something that you're going to routinely do when a patient comes in and they believe that they have a sinus infection. You're going to palpate the maxillary sinus and the frontal sinus. Typically, with a sinus infection, that will elicit a pain response. All right, so when appropriate, palpate and auscultate the temporal arteries, and you are looking for thickening, hardness, tenderness, any bruise. Inspect and palpate the salivary glands, and with infants, transilluminate the skull. If the infant has a rapidly increasing head circumference, so they may actually be have increased cranial pressure by it having an increased fluid in the brain, and I I haven't I saw a few cases of this in my career. One in particular, and the baby was born with this. I think she was born by C-section, but she had an enormous head, and she ended up having hydrocephalus, and it was an interesting, very interesting case because she was hydrocephalus, so she had water on her brain, fluid on her brain, and plus she also was anencephaly, so she didn't have a fully developed brain. It was weird because typically when infants are born anencephalic, they look very they almost don't look human like because there is no brain to fill out the head. All you see is his face. But with this little girl, you could see it perfectly. She was a beautiful little girl, and she had this nice head, but and she lived for several years. She went to a nursing home where they take care of babies like her, and she had very supportive, loving parents. Um, but it was just her care was beyond their capabilities, and they were very good parents to her. But I digress. All right, the neck. You're going to inspect the neck for symmetry, alignment of the trachea, any fullness, masses, webbing and skin folds. So you're definitely looking, when I think of the neck, I always think of the thyroid. So you're looking for the tracheal position, tracheal tug, movement of the hyoid bone and cartilages when swallowing, the lymph nodes, joints, musculature, and spinous processes. And then, of course, you've got that thyroid in there. When you're feeling to palpate the thyroid, what you're really looking for is movement. So if you put one hand on each side of the thyroid and ask the patient to swallow, you should be able to feel that thyroid move up and down. That's essentially all we're looking for. And then you would palpate it to see if you have any nodules or not. And a large thyroid, it's one of those things, you think to yourself, gosh, how am I going to recognize an enlarged thyroid? Don't know. How am I going to do that? Well, when you feel one, you just know it because it is so much larger than any of the other ones you have ever felt. And then the patient will need to go in and get tested, get some blood work done. Oh, here we go. I'm always one step ahead of myself talking about the thyroid now. With infants, the cranial bones, they're very soft. They have sutures. The skull may be molded from the birth process. The skull bones might shift and overlap. The fontanelles permit for skull expansion. Um, the sutures ossify from 16 to 18 years, and those fontanelles, they have two fontanelles, one in the back, one in the front. The one in the back closes by 2 months. The one in the front, which is the larger one, closes by 12 to 15 months. And when you're looking at children and adolescents, you'll see that there are subtle changes throughout childhood. Um, as they mature, their facial features change. You think about it when they're little, they don't have any teeth, and then they get teeth, so their faces change, and then the baby teeth fall out, and the adult teeth come in, and so that again changes their facial features, and then they grow, and those fatty stores begin to diminish, and so lots of changes that you'll witness, and I have had the pleasure of taking care of some patients from child to adulthood. So I've been able to witness that. And when young men begin to develop facial hair and their voices start to drop, in pregnant patients, the fetal thyroid becomes functional in the second trimester. Pregnant patients require increased iodine, and you might detect a slight enlargement. It's not uncommon at all for women to develop hypothyroidism after pregnancy. In older adults, the rate of T4 production and degradation decreases with aging, and that thyroid becomes more fibrotic. So, let's see. A patient that comes in, history of present illness, head injury. So, we want to know an independent observer's description of the event because if it was a head injury and they lost consciousness, or they may not have a full grip of what happened. What's their level of consciousness? Did they lose consciousness? Any predisposing factors and associated symptoms like vomiting, headache, or amnesia of the event. The history of the present illness continues with the onset, duration, location, character, severity, visual, prodrome, pattern, change in level of consciousness, episode pattern, precipitating factors, associated symptoms, medications, and treatment efforts. So, were any of these things related to the head injury? And again, history of present illness was there a stiff neck, neck injury or strain, fever, headache, any history of meningitis, character, predisposing factors, efforts to treat, medications. So this is our patient that has a stiff neck, not a head injury. History of present illness with a thyroid problem. Do they have a change in temperature preferences? Any neck swelling? And these are questions that we ask the patients because they don't know. If we ask them, well, what's going on? Sometimes we need to help a little bit by prompting them, by asking them, have you had any change in your hair, skin, or nails? Does it feel coarser to you, more brittle? Do you see anywhere on your skin where you've got an increase in pigmentation? How has your mood been lately? And increased prominence of eyes. Any episodes where you feel like your heart's beating really, really fast in your chest? Are your periods regular? Any irregularities? Bowel habits, and any medications that they may be taking. So think about all of these things. These are our prompts when we're doing our investigation. This is our investigation here. We are asking these prompts to try and gain clues so that we can come to a conclusion. Now let's look about past medical history. These are some statements that may be of interest or that we may want to use in our um, interview of the patient. Do they have a history of any traumatic brain injury? Have they ever had any subdural hematomas, radiation treatment, lumbar puncture, history of headaches, any tumor, surgery, or goiter, seizure disorders, thyroid dysfunctions? So these are questions about the past medical history that we may want to prompt. So we say, do you have any chronic health conditions that you've been treated for on a regular basis? No, not at all. And then you say, well, do you have any history of headaches? Oh, I do. I do get headaches once in a while, and they're really severe, throbbing headaches. So sometimes you need to ask that probing question. Now let's look at our personal, social, and family histories on the interview. What kind of work do they do? Are they in school? Do they participate in sports? What's their nutrition? Any stressors, injury risk, use of recreational substances? Their family, what's their family dynamic? And for infants, we want to know the prenatal birth history, shape of the head, any congenital anomalies like low set ears or abnormal facies, and acute illness. But you have to consider sometimes these uh, funny looking low set ears and facies can be due to birth trauma. Um, my son looked like, I don't know what when he was born. He was big, he was almost 10 pounds, and his ears were so swollen they just looked like masses of flesh on the side of his head. But after a month, he was a normal looking kid. So sometimes you have to take that into account in newborns. With older adults and pregnant patients, so these are our special populations. We always call pediatrics, pregnancy, and older adults our special population. And for pregnant patients, we want to know their gestation, any pre existing disease, pregnancy induced hypertension, or do they use any drugs? With older adults, dizziness and vertigo is always important to identify, not just with this topic, but across the board in the older adults. Weakness or impaired balance. All right, where are we at here? Um, Now, the physical examination. So we're doing this in stages, right? So we did the interview. Now we're doing the physical exam. And remember, we're not going to do every single aspect of this physical exam. We have to pick and choose what we're going to do on the specific patient. And we've gained that information through our interview. So on the inspection, we're going to look at facial features, symmetry, faces, head position and shape, skull size and shape, scalp hair pattern, ticks and spasms. When we feel, skull is symmetric and smooth, scalp movement and hair texture, temporal arteries, temporomandibular joint, salivary glands. We don't usually percuss on the head. Um, Auscultation is also not usually done, but sometimes you'll listen for a cerebral aneurysm or temporal arteritis. On the neck, inspection, all of these things, muscles, symmetry, alignment of the trachea, landmark of triangles, fullness at the base of the neck, masses, webbing, unusual shortness, asymmetry, carotid artery prominence, jugular vein distension, range of motion. Palpation, tracheal alignment, we want it to be smooth and tender. Um, no tracheal tugging, which is um, suggests an aortic aneurysm, and we're feeling the lymph nodes as well. The thyroid gland, we want it to be symmetric. We're looking at the size and contour, shape, tenderness, nodules. You can auscultate it for vascular sounds. If in a hypermetabolic state, the blood supply is dramatically increased. So, vesicular bruit, a soft rushing sound, can be heard. I've never heard it. In infants, you're checking their head, symmetry and circumference, head control and position, movement, fontanelles, hair and headline, Oh, headline. Hairline, scalp, scaling, crusting, caput, cephalahematomas, face for features of symmetry, paralysis, skin color, neck symmetry, size, shape, range of motion. It seems like an enormous amount to do, but you're really, you're doing two, three, four of these things at the same time. Palpation, suture lines and fontanelles, craniotabes, softening of the outer table of the skull, neck, muscle tone and masses, trachea, clavicles. Transillumination for suspected intracranial lesions or rapidly increasing head circumference. And we don't do that much because we do a CT scan instead. With children, percuss the skull with one finger to detect the McEwen sign. So this is looking for hydrocephalus or brain abscess. It sounds like a cracked pot when you do that. Bruits are common in children up to 5, and the thyroid may not be palpable. Pregnant patients and older adults inspect for cholasma, which is that mask of pregnancy, hypertrophy of the thyroid, auscultate for a bruit. For older adults, the faces vary with nutritional status. They may have sunken eyes, loose, wrinkled eyelids. Look at their range of motion, any pain, crepitus, dizziness, jerkiness, limited range of motion, and palpate the thyroid for nodules and any irregularities. Abnormalities on the adult, headaches, salivary gland tumors, which is usually in the parotid gland, hyperthyroidism, myxedema, Graves' disease, Hashimoto's, super common. Thyroglossal duct cyst, brachial cleft cyst, torticollis, encephalocele, which is a neural tube defect, where it's like spina bifida but at the base of the neck. Hydrocephalus, which is fluid on the brain caused by blocking of cerebral spinal fluid. Microcephaly, small brain, craniosynostosis, premature closure of the cranial sutures. And this is interesting. These have to actually have surgical intervention where those pieces need to be opened because otherwise the brain can't develop. And we are going to pass on this. We're not going to do the questions. So I hope that you found this interesting.